Good morning, good afternoon, good evening. How are you all doing? We're so excited that you're able to join us today. And we have the pleasure of presenting to you one of the webinars from FIP, webinar number 10, Responding to the Pandemic Together. Our focus today is going to be experiential education in trying times. It can be done. Let's learn how. This webinar is coming to you from FIP Ed. That's the FIP Academic Institutional Membership Group, the Academic Pharmacy Section, the Workforce Development Hub, and our International Pharmacy Student Federation. My name is Toyin Tafade, and I'll be moderating the session today. I'm Dean and Professor at Howard University College of Pharmacy, and I'm very excited to be joining you today. I serve in a number of roles in FIP, as Secretary of the Academic Section, Leadership Development Lead for the Workforce Development Hub, and I'm also an AIM advisory member. One thing we want you to be aware of is that FIP is hosting a special webinar series on COVID-19. These webinars aim to provide relevant information and guidelines for pharmacists and for the pharmacy workforce on coronavirus. We want to make sure that we share and discuss strategies that are adopted by pharmacy leaders and workers, including our member organizations. We also want to make sure that we provide the implications even of this virus and some of the innovations and approaches that have been adopted across the pharmaceutical sciences, practice, and education sectors. We would like to engage frontline workers of the health and pharmacy workforce so they know about the realities that are facing them around the world. So we thank you for participating today. We also would like to discuss implications of this pandemic and consider the impact of the disease on patients across age groups with concurrent conditions. If at any point in time you have a question or would like to share an idea on webinar topics, we ask you to contact Lena at fip.org and she'll be happy to address this matter. There's several important links and resources that we want you to be familiar with. And on the website at www.fip.org/coronavirus, there's a comprehensive web page there. There's also a Facebook group for you to participate in so that you can be up to date on resources that could serve you, your country, and your organization. Perhaps you're joining us today as a friend of a friend who's a member of International Pharmaceutical Federation, FIP. FIP is the global federation of national associations representing 4 million pharmacists and pharmaceutical scientists around the world. The mission is to improve global health by supporting the advancement of pharmaceutical practice, sciences, and education. The vision for FIP is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and pharmaceutical care. You may not know this, but FIP was founded in 1912 in the Netherlands. The Academic Institutional Membership, or the AIM group, is actually the only global network of academic pharmacy leaders. 160 pharmacy and pharmaceutical science schools are members, and they're hailing from about 55 countries. Perhaps your college or school is not yet a part of AIM. We invite you to join AIM or find out more information at aim@fip.org. This year, we're already planning for the Academic Pharmacy Leaders Program, which is supposed to be scheduled in September. Stay tuned for more details. There's some really good programming that is coming your way, and that's at the GALF, or the Global Academic Leaders Forum for 2020. More details about registration and the program can be seen in that link. I'm also pleased to inform you that we have a group of colleagues from all around the world who serve as AIM Advisory Committee members. So myself and Ralph Altier, representatives from the Americas. We have Muila Chiluba, Yahaya Chunara from Africa. We have Liliane and Yulia from Europe. We have Byung-Jin Lee and Rajani from Southeast Asia. We have Mohamed Royal and Abla Mahmoud from Eastern Mediterranean, Paul Gallagher and Carla Mara from the Western Pacific. I'm honored to serve with these distinguished colleagues from around the world. So for you, as we start this webinar, please note this webinar is being recorded, and so you'll be able to access it freely, and it's available on the FIP website at www.fip.org/coronavirus. You may ask questions by typing them in the questions tool on your screen. At the end of the webinar, we will be taking all your questions and we will be addressing those. The panelists will be addressing those. So we thank you again for your engagement with all of this. Your feedback is welcome, and you can send feedback to us at webinars@fip.org. I'm going to ask that as you put something in the chat, please let us know what country you're calling from. It's really very helpful to us. We're so energized when you join us on these webinars, and we thank you for your connectivity during this whole time. The co-organizers for this planning committee are listed here. As I had mentioned previously, Ralph Altier and myself from the AIM group. From academic section, we have Christy Galbraith from Australia, Monash. We have Patricia Acuna Johnson from Chile. We have Marwan Arkel from Lebanon. And from the FIP Academic Workforce Development Hub, the Academic Capacity Group, Claire Anderson from Nottingham, Patricia Acuna from Chile, and Sean Gleason from Colorado in the US. And our distinguished student from Ghana is Priscilla Owusu-Mensah from the IPSF group. All panelists are going to be introduced in the next few minutes by Megan Thompson. Megan Thompson, for those who may not know her, is our lead panelist today. We are so excited to have Megan Thompson join us. And she is an associate professor and director of the Office of Experiential Programs in the University of Colorado at Skaggs School of Pharmacy. And she has put together, in collaboration with a distinguished panelist group, this whole webinar around experiential education. Megan, welcome, and over to you. Thank you so much for your leadership with this.
Thank you very much, Toya, and I'm so happy to be here, and thank you all to my colleagues, the panelists, who I'll be introducing in a moment. As Toya mentioned, my name is Megan Thompson, and I'm at the University of Colorado in the United States, and my focus areas are really on experiential education, obviously, curricular design, but also in the area of resilience and of students. And so both of those things combined really helped us get through what we've been dealing with in the last 8 weeks or so. I would say that in planning for this webinar, the title of it, Experiential Education in Trying Times, It Can Be Done. If you asked me about 6 weeks ago, I wasn't sure if it could be done. But here we are, and we have developed some interesting ways to achieve the goal of experiential education. And you'll hear a lot of nice examples from the panelists about how the panelists have, how their institutions have addressed these challenges, and also provide you some solutions and ideas maybe that you can take forward at your own institutions if you're struggling with the same sort of issues. So today, I'll be talking also just to review the objectives today. Apologize for there's a slight delay in the slides. But we will be sharing with you and discussing the challenges facing experiential education in this current environment, describing the varying types of experiential education that can be provided. So you'll hear examples of experiential experiences that are live, that are still live, experiences that went to completely remote, simulated experience, competency-based, and also work and internship-based, and others. We will also discuss some implementation steps, some challenges and rewards in providing experiential education, all while considering the student, the faculty, and the regional differences. So I will give you just a brief overview of our panelists today. And as Toyin mentioned, we are so excited to have Priscilla Owusu-Mensah. She's a fourth-year doctor of pharmacy student from the Kwame Nkrumah University of Science and Technology in Ghana, and as she mentioned, she's an IPSF mentee, and we are so grateful that she's going to give a student perspective, which we're very excited about. The next panelist is Jamila Jordan Jamila is an assistant professor and director of experiential program at Howard University in the United States. Her focus is on development and assessment of experiential programs and experiences, and also site and preceptor development. We're so happy to have Jamila join us today. We also have, excuse me for the delay, Fouad Sakr, who is a clinical assistant professor and chairman of the PharmD program at the Lebanese International University. We are excited to have Fouad share some examples. He has some very interesting things that they've been doing there. His focus is on design and implementation and assessment of experiential education, but more importantly for this discussion is the creation of experiential learning opportunities, which they've been very creative. We're excited to hear from Fouad. We also have joining us today, Vibhu Solanki. Vibhu is an associate professor in community pharmacy practice and education at the University of Nottingham. And Vibhu has a lot of experience, extensive experience using simulation in pharmacy education. And he's going to be discussing how this has really helped, assisted in achieving experiential related outcomes. Our next panelist is Simon Ferletti. Simon is the senior lecturer and student experiential placements manager at Monash University in Australia. And his focus is mainly on development and implementation of experiential programs, but also he's also part of student support system. And Simon will be talking about we'll be addressing some issues about student anxiety around this issue. So we're excited to hear from Simon, what they've done in Monash. Our next panelist is Caroline Weinstein Oppenheimer. She's a full professor in molecular biology and immunology at the University of Valparaiso in Chile. Her research is, her focus is research and education from the basic science perspective, but Caroline also has some things to share about issues surrounding student anxiety as well. Next slide. Finally, our final panelist will be Kyle Wilby, an associate professor of pharmacy education and associate dean of the School of Pharmacy at the University of Otago in New Zealand. And he is up late this evening. I think he is the latest time. So I think it's midnight there. So thank you, Kyle, for staying up late. His focus is on design and implementation and evaluation of experiential education, particularly in the Middle East and in New Zealand. So next slide. So the student experience, before we jump into the student experience and hear from Priscilla, I want to talk about the format of the webinar. 4 main topics or questions emerged as we were planning for this webinar. And the 4 challenges, these were 4 challenges that were consistent among the group, among the panelists. So what we have done is we've done our best to answer these challenging questions, and our panelists will share what they did to address the challenges, in addition to providing solutions that perhaps you can use to help solve similar issues at your institution. The 4 main questions will be, what has your school done to address the challenges or various restrictions and placement issues? The second question is, what has your school done to address student anxiety and concerns about caring for sick patients or even progression issues? The third question is, what are accreditors or regulators doing to help? And the fourth question is, what can we do? What things can we do now to help us move forward in the future? So, but let's hear from our student Priscilla. As I mentioned, so students are the most concerned. They're at the epicenter of this issue, right? With these challenges that we're having. And really, students are very concerned about this situation, how it will affect the quality of their experiences, their ability to meet curricular and accreditation outcomes. But most importantly, for them, I imagine, is how it will affect their progression. So without further ado, Priscilla, I will hand it over to you. Next slide.
Okay, thank you so much, Megan. It's an honor to be here. So moving on to my part. So just as almost all of us, we didn't know that a pandemic was going to hit the whole wide world. And we're just going about our normal student activities, going for class, labs, and all that as pharmacy students. And just as many schools in the world, all of a sudden we had to go home to keep us safe and COVID-19 free. And I must add that for me, it was at the brink of our mid-semester examination. So you can just imagine how much you put so much effort in learning for an exam you think you're having the next day, and then it comes up that everybody go home. That was quite frustrating. So a wise man once told me that we adapt to survive. So in view of that, lecture notes accompanied with commentaries were provided to keep us busy until school reopens. Initially, we're told, oh, we're going to come back to school very soon. But then 1 month passed and 2 months passed, and they had to do something for us. So I like to also say that being at home makes you feel like you're missing out on a lot of experience. And I'd say this particularly for our 5th years and our 6th years for the PharmD course, because for 5th and 6th years, the whole semester is experiential training. They go to the community pharmacy, they go to the hospital, they go to the industry, and they're allowed to choose electives. So they go on the field, they pick cases, they come, they use a SOAP approach on the cases, they present the cases. And for our 6th years, the whole year is clinical rotations. So you can just imagine how much they're missing out on from being at home. So it's been what I call a frustration galore, not knowing when school reopens and what to expect, especially concerning the license exam, because they're missing out on quality experiential experiences. And good to know is that apart from worrying too much about school, you get to try out new ventures, because most of us know that the pharmacy course is packed up and then you don't really have time for other stuff. So personally, during this time, I'm working on a research on substandard and falsified medicines with IPSF's Young Researchers Forum. I like to also add that simulations and other virtual experiences would be great, as it would keep our minds active and engaged. I have come to understand that what you learn in class is different from the confrontations you meet when you go on the ward and at a community pharmacy. There's one thing just reading the lecture notes, and there's another thing being confronted with cases. So both are very necessary. The theory, the experiential training is very, very necessary. So simulations and other virtual experiences would be great to keep our minds engaged and to keep us active. So that's what I have to say. Thank you so much.
Thank you, Priscilla. I understand your concerns about wanting to do things live and in person, and that, but that, in my experience, the students have been very appreciative of what the schools have been trying to do to address these issues. So thank you for sharing that. We'll be hearing more from Priscilla a little bit later in the discussion. So right now we'll switch over to the other panelists. And before we go on, I'd like to just set some ground rules about terminology today. And I apologize, there seems to be a little bit of a lag in the advancement of the slides, but so some common terms that we'll be talking about today. If you hear the term experiential learning or internship or placements or apprenticeship or clinical training, IPPs, APPs, PPEs, all of those things, we're all talking about the same thing. We just use different terminology around the world. So for this presentation, all of these terms refer to the non-didactic learning or learning that occurs on site or simulation or at pharmacies and hospitals and things like that, just so that we're all on the same page when it comes to the terminology. So as I mentioned, there were 4 main questions that emerged from our planning committee, from our panelists. And the first question is, what have other schools or universities done to address the various restrictions and placement issues? So and again, I apologize for the lag time here. I can tell you, so here's the question. So in the United States and in Colorado specifically, we experienced several restrictions, as I'm sure all of you have. So we had national restrictions, which prohibited our students from traveling. We have students who travel all over the world to complete rotations or to complete their experiences, but our students were no longer able to travel. We had state and local restrictions. We had stay-at-home orders, so students, not only were they not allowed to travel, they weren't allowed to leave their homes. The university also had restrictions. At one point, the university said that no students could be at clinical training sites, particularly in rural areas. But also then we also experienced site restrictions. Sites were not allowing students to be practicing. Actually, they weren't allowing to even have them come into the doors because they wanted their preceptors and their healthcare team to focus on patients. So there were lots of restrictions in place. In addition to that, we also had accreditation requirements. Our accreditation requirements still have to be met. There is no waiving of those requirements, and so that became a very big challenge for us. If we are not able to place students on their experiences because either the site won't allow them, or they have to stay at home, they have to stay indoors, or there are travel restrictions, how are we going to have these students meet accreditation requirements? Well, our primary goal in Colorado was to ensure that there was no delay in graduation. So at the time of the restrictions, our students still had to complete one full clinical experience. We have 6-week experiences here in Colorado, and our students still had to complete one final clinical experience before they were able to graduate. To complicate matters, about half of the students still had required experiences to complete. So we have our accreditation body requires students to complete a set number of community, ambulatory care, and hospital rotations. They also allow students to do elective rotations. Well, half of our students still have the required rotations, which is a little bit more difficult. There's not a whole lot of flexibility with the required rotations. There's a little bit more flexibility with elective rotations. So how do we do this? How do we make sure that those students have enough hours to meet the accreditation requirements and also have enough hours to meet it, have enough hours to meet the accreditation requirements? So what we did was we developed 2 virtual rotation experiences. This was 100% remote, 100% online experiences, even for the required rotations. We developed one that was specifically to hospital and one that was specific to ambulatory care and community. So students were either assigned the hospital experience if they had that to complete, or the ambulatory care if they had that to complete. The other students who had elective rotations to complete were put into the ambulatory care community rotation. So ACPE, our accreditation body, made a pandemic-only exception in terms of direct patient care and did not require students to physically be on site at a practice setting, given the numerous restrictions. But again, direct patient care still had to occur. So for the hospital rotation, students were granted access to patient charts to the medical record for patients on the internal medicine units at our main teaching hospital here on campus. And they also had access to the medical intensive care units patient charts. And preceptors were the faculty who were on service at those hospitals. So students were able to give recommendations, provide drug information, and make interventions real time to the preceptors, since the students had access to the medical records and really were actively seeing patients just from afar. For the ambulatory care community pharmacy rotation, this was largely case-based. The ambulatory care faculty provided cases to the students. It was based on telemedicine consults that they had that day, and the students were asked to provide recommendations, perform literature evaluations for other healthcare providers, and so on. Really, it was our faculty who we relied heavily on our own practice faculty. It was really our faculty who came to the rescue, because the external preceptors were not able to take learners on site, and even if they wanted to, their organization said that their main focus was on patient care, not on student learners. So the students were assessed using a newly developed grading tool specific to this virtual experience. So some lessons learned that from this exercise that we did, or this creation of this virtual rotation experience, was that it's important, if you are interested in doing something like this for your students, it's probably best to create an experience for a large cohort of students. Don't try to do a virtual experience for each individual student. It's just a very difficult task. You're asking preceptors to change their whole practice and try to create a virtual experience. So for us, creating an experience for a large cohort of students was important. But also consider your needs. Do you need students to have access to patient information? We did, because we had students who still had to meet requirements, accreditation requirements. So that was a hurdle that we had to jump, but our sites understood, our main teaching hospital understood that our students they didn't want the students to have any delays in graduation, so they were very gracious and granted approval of students to have access to the patient charts. Of course, this should not be used as a substitute for the majority of experiences. We all know that this is not really what experiential education is, right? It's not online learning from a computer, but it did definitely help in this emergency situation. And students did have a great appreciation for this experience, that mostly because graduation was not delayed. But really, the students really do prefer to complete rotations live. So that was one example that we did in Colorado, the virtual rotations. But my colleague at Howard University, Jamila, would like to talk to you now about rearrangement of the schedule and how you might think about doing that to address your experiential needs. Jamila.
Yes, thank you. And hello, everyone. Thanks for joining this webinar. As with everybody, the COVID-19 pandemic has really upended all of everyone's lives, and it's extended to the experiential portion of the College of Pharmacy educational process. The COVID-19 pandemic has really changed how we set up rotation and our necessary steps that we take in terms of scheduling students. One thing that we looked to do was one thing that we looked to do in terms of addressing the situation was the rearrangement or rescheduling of student rotations. However, there's a lot of challenges and issues that come along with it. Now, one of the questions that we had in terms of rearrangements of schedules included the biggest question of the pandemic today. When will this end, and when will we get back to normal? Obviously, there is no end date in sight. There are guesstimates of when the pandemic may start to wane and when different sites, cities, locations, and countries will come back open, but nobody really knows. In times past, experiential departments will kind of make changes to a student pharmacy schedule based on a definite time or situation. So, for example, if a preceptor went on vacation, if a preceptor had an increased work faculty load, or if they may have went on maternity or paternity leave or had different site issues, we would make the necessary changes to the student schedule. However, due to the COVID-19 pandemic, we really don't know when this end is going to be. So there are going to be some challenges centered around making the necessary rescheduling. However, these are some of the steps that we took at the Howard University College of Pharmacy. One, we looked at the regulatory body's requirements for graduation and also our specific College of University graduation requirements to make sure we're meeting them for all of our students. We also looked for the licensure requirements for our localities and also within the nation. As Megan mentioned, we can't take away any requirements that are necessary for either graduation or licensure. These are set in stone, but we want to make sure that we're giving students the opportunity to get the robust pharmacy practice experiences needed for them to graduate and to meet all necessary requirements. Additionally, when we're looking at the new pharmacy practice year, we wanted to look at what students' post-graduation plans are. All students really want to get a job once they graduate from their respective college or university or pharmacies, but some students have specific wants and desires that may center around postgraduate training or education. These may include residencies and also fellowships. So we really want to take this into consideration when we're making changes to a student's schedule. We also have to look at the spacing and availability at different preceptor sites. There are some preceptor sites that cannot take students throughout the year. They can only take students 1 or 2 times throughout the year. So a cancellation of the experience will lead that student having to find a new pharmacy practice experience. So what did we do to address these issues? We at the College of Pharmacy at the Howard University, what we did is looked within our current practice sites to see what modifications can be made, what experiences can go virtual, what practice sites had the ability to move to a telehealth, a telepharmacy situation, and what practice sites also could safely bring in students at their practice sites. These sites would have the safety precautions put into place to allow students to safely be here, but not be a danger to any preceptors, staff, and more importantly, the patients. We also then expanded our reach and added new virtual sites. These sites were able to have students do elective rotations that either would be virtual or they could expand on telehealth or telepharmacy services. We then moved pharmacy students into these sites as needed and as the need arise. We also tried to move students back any pharmacy practice that could not really meet the restriction or could not really allow students to be on site. We tried to move those experiences back in the year, thus allowing students to still get the necessary experiences they needed for graduation and any postgraduate training, but also allowing time for maybe the pandemic to subside or those actual sites to put in the necessary procedures to bring students back on site. With these steps, we are hopeful that we're being very successful in just keeping, as Megan mentioned, students on an on-time graduation track and also giving them the experience needed for any postgraduate training or experiences and employment opportunities, but more importantly, making sure we're meeting the requirements of the College of Pharmacy and also the state and local boards of pharmacy. Thank you so much.
Thank you, Jamila. That's an excellent point. Excellent points you've made here, working with your school and college in terms of graduation requirements. That is something that we found was very critical. We worked with our registrar, talking about course credits and how how many course credits the students still needed to achieve to actually graduate from the university, not just accreditation requirements, but from the university as well, and also taking into consideration the State Board of Pharmacy. So thank you for sharing that.
Thank you.
It sounds like you had to get very creative there.
Yes.
All right. Well, I'm very excited to hear from Fawad from Lebanese International University, because they did something similar too in creating remote virtual experience. So Fawad, please share.
Hello, everyone. Thank you, Megan. It's 3 p.m. in Lebanon, so good afternoon. I'm very glad to be here today in this discussion. Well, perhaps the experiential component was one of the most challenging parts of the distance education during this COVID lockdown period. And the greatest challenge, as you and Jamila mentioned, is the safety of our students while maintaining on-time graduation. Particularly because restriction of access to practice sites would delay completing the PPEs and APPEs for students who are planned to graduate early this summer. So I will be sharing our experience at the Lebanese International University today with you. We are using remote virtual practice experiences with real patient cases in both the B-Pharm and PharmD programs. We capitalized for this purpose on the input of our faculty preceptors, who are already an existing integral component of the experiential programs, and usually work in collaboration with the site preceptors to achieve all learning objectives. So during these challenging times, the faculty preceptors filled the gap of restricted access to practice sites by sharing with each of their students real patient cases and information documented as SOAP notes from previous rotations. Then the students are given a couple of days for preparation And a meeting via Google Meet platform takes place to discuss the SOAP notes, evaluate the patient problem list and pharmacotherapy, provide suggestions for possible interventions, along with other talks and discussions that usually take place in the practice site between the student and the preceptor. Also, during the discussion, the faculty preceptors, create different scenarios to mimic the day-to-day clinical situation of a patient case. Also, the preceptors are assigning some additional learning activities to the students to prepare, for instance, drug reviews, topic presentations, and journal clubs. All of these activities are also being presented online to the preceptor and to the other students within the group of that preceptor. I want to add that all online activities are taking place during the regular on-site meetings schedule to avoid any time conflict for the preceptors and for the students. It's also good to mention a few words about the assessment part, as we are still using some of our regular assessments, including the rubrics of SOAP notes, preceptor evaluation, student self-evaluation, reflective writing, presentations, and other assessments. Of course, the assessment forms are slightly modified to exclude points related directly to on-site activities and that cannot be assessed with these virtual rotations. There is some concerns, and it's clear and obvious that these experiences are not identical to the regular daily clinical activities, and they cannot replace in the future the routine experiences. And also, these alternative experiences may be associated with technical difficulties. For example, in Lebanon, the availability and the quality of the internet. However, to conclude with, I can proudly say that all faculty preceptors are having a great input to make these experiences smooth and efficient. Also, the national regulators, they have provided some good support with this regard. We will be talking more about this point during the discussion. Thank you.
Thank you, Fawad. It sounds like you had very similar experience with utilizing your faculty. We definitely relied heavily on our faculty. They carried much of the burden on this, but you know, and similarly, you know, our faculty, they were very invested in the students and did what they needed to do to make sure that our students could get a good experience. So thank you for sharing that. That's very interesting. Thank you. Well, one of the other areas in experiential education that is becoming very popular in the United States lately is simulation, and the use of simulation in experiential education. So I'm very excited to hear from Vibhu from the University of Nottingham, who has extensive experience in the use of simulation. So please share with us how you were able to use this to your advantage.
Thank you, Megan, and good afternoon from the UK. So just to talk to you a little bit about simulated learning and gamification, I think we were lucky in the sense that we had already set up at the University of Nottingham this gamification and simulated learning experience already. Now, placement issues, as my learning colleagues have already spoken about, are certainly magnified now, but certainly within the UK, they've been around for a while now, trying to get our students into placements, especially at undergraduate level, is often quite difficult. A lot more easier within internships, within larger placements, with respect to them going onto the pharmacist register. But certainly at undergraduate level, smaller placements have always been a bit of a difficulty with respect to placement providers and stakeholders within the UK. So one of the things that we did was to think about the opportunities to develop experiential learning through a simulated environment. And as a consequence, we were able to put together a number of pharmacies where our students will go in and essentially run a pharmacy within a fictional setting of what we call Pilchester. As a result of that, our students are essentially given a simulated environment where they are exposed to patients, they're exposed to problems. Now, that is very much a face-to-face scenario, and over the past 5 years, we've been delivering this simulated learning, experiential learning environment to great success. Once again, the same pressures that apply to everyone else. COVID arrived and it had a big impact on that face-to-face learning. So with regards to addressing some of those concerns, we too also went to an online system. Now, the importance with moving from face-to-face to online is trying to do too much. Now, essentially the learning outcomes were the same. It's just about translating differently as to how they are potentially achieved. So for us, the big success was measured in terms of the ability for the students to connect with the academics, with their peers, and with the content. And so it was important that we were able to sort of translate some of these cases, some of the simulated cases, some of the scenarios with respect to an online format. Now, we had slightly different difficulties with regards to using our preceptors as opposed to Lebanon, in the sense that a lot of our preceptors, a lot of our what we call teacher practitioners were drafted into the front line with regards to supporting hospitals and community pharmacies. So as a consequence, a lot of this was delivered via the extended academic group. Essentially, we arrange for students to have within groups online consultations, and those online consultations were supported with additional videos that showed how a pharmacist would essentially handle that particular case. And essentially that was the most simplified way in which we were able to replace some of those face-to-face interactions. I suppose going forward now, the difficulty around this is obviously applying the social distancing measures. We're going to have additional, with regards to the New World, additional financial, operational, logistical and educational pressures that come into play. And then we also need to think about what the student essentially wants. We will have a new intake of students, and I think as healthcare students, their expectations are for us as a university and shared universities to prepare them for vocational training. So we've got a big challenge on our hands to ensure that we develop a blended approach to learning for our students, both asynchronous and synchronous, but taking into account that the increased amount of online content, crafted well around some face-to-face contact, but then applying those social distancing measures. So it's going to have a real challenge with regards to logistics, and I think that's what a lot of us are going to start facing as we move forward. But I think those opportunities are certainly there for universities who can't get those placements into place to start implementing, even at a basic level, simulated learning environments. Thank you, Megan. Back over to you.
Thank you, Vibu. I think that's an excellent point that you made about the challenges of really finding a balance between simulation and also live. I mean, the public expects that healthcare trainees are learning in a live environment, not just a simulated environment, but simulation can certainly help, and you've provided some really nice examples of how you can use that to supplement some of your experiential training. So thank you very much for that. All right, so question 2, how are you addressing student anxiety about potential delays in education, caring for sick patients, and not being able to train in the experiential environment? And this is a big concern of our students, and this is something that our university, our school, our Office of Student Services, we've all been handling these concerns from students, and it's real. It's absolutely, we understand the concerns. We have students here in Colorado who are afraid to go to certain areas in Colorado and care for those patients for fear that they might get ill, or if they're in a rural area and staying with a host family, for instance, they're concerned that they might get their host family sick. So there are a lot of anxieties, but also about progression and delays in graduation and so forth. So we will talk about that now. So our next panelist will be Simon Ferletti from Monash in Australia, talking about what they have done to address some student anxiety concerns. Simon, the floor is yours.
Thank you, Megan. I suppose the main thing that we needed to look at particularly was when we were, when COVID really started to ramp up in Australia, we already had students out on extended placements. So we had our 4th year students, so final year undergraduate students going through not their first rotations, but their first rotations for the year. And as they were there, more and more information was coming out around the pandemic's development, both in Australia, but also overseas. And for anyone who's been keeping an eye on what's happening in Australia, Australia hasn't been hit nearly as hard as other countries around the world, but we have had to make adjustments due to social distancing and shutdown measures. But within that, we had students coming through the woodwork early on, expressing major concerns. And there were kind of those 2 domains of the student concerns. One was concern for their physical health and safety and their own wellness. But also then we had the other side, which was they didn't want to stop being on placement. So we had two different camps of student who wanted polar opposite things. One wanted to be passed and successfully complete their placements without having to actually do anything, and the other ones wanted to get in the trenches and be in the rooms with COVID patients providing pharmacy services. So we were trying to balance these 2 different cohorts and their different perspectives. But then when we were looking at it around the start of March, Monash University basically said there's no more on-campus teaching. So what happens with Experiential? And Monash took quite a strong leadership position in Australia, saying we're comfortable having our students still go out. And I'll talk about that later in terms of accreditation. But that also meant that our students saw other universities get pulled off placement and felt like they were at risk. So we really needed to make our approach appropriate to really make sure that our students understood that we were looking after them, but also that we wanted what's best for them. So we really had to ensure there was a few different things. So we had similar approaches in terms of redesign of placements to what Jamila mentioned at Howard. For our experiential learning program, where we had to ensure that we met the performance outcomes of our accreditors. So we couldn't just basically make up what the placements were going to be. We really need to make sure that our unit requirements were met from a university standpoint in terms of the hours, and the content of that was meeting the learning objectives that we had set out when we kind of came into this year. Our colleagues in Malaysia, at Monash Malaysia, in Sunway, we're having a slightly harder time of this because their shutdown was significantly more extensive. So they had to do a different track to us. But the real main thing that we had at the end of the day was we needed to ensure that our students were coming out well qualified. We have a quite an extensive experiential learning component in our undergraduate course in comparison to other schools in Australia. And we really want to make sure that our students were coming out, because that's the expectation of the public and it's the expectation of our profession, that we're not sending out underqualified students. So within our redesign, we really needed to make sure that they were COVID-19 safe as much as we possibly could. We couldn't just keep things as normal. So we really had to make sure that we allowed our students to understand that they were in a safe environment, or as safe as was possible. So within that, we also wanted to translate to our students how they contribute. So our students are pretty clear on the expectations of pharmacists, and they've really built a strong professional identity, and that was really helpful in making them understand their roles. So we worked with our partners, we really collaborated with our external preceptors. We have no internal preceptors working in the site. So we have community pharmacy sites and we have hospital pharmacy sites, and all of those are external. Some of them are hired by Monash for lecturing, etc., but they're all employed under their own healthcare settings. So we worked with them in order to look at our entrustable professional activities, which is what we use for assessment, into how we could create some new EPAs that would allow the students to continue their placement in a safer way. So maybe less clinical patient-facing EPAs and more supporting mechanisms to allow them to contribute to the pharmacy service provision. By doing this, by this redesign, we were able to translate to the students that their placement wasn't a high risk health service provision, and we were able to allay some of their concerns. But probably the major thing that we did that really addressed the student anxiety through our redesign was providing the students, really making it clear what the students' options were. We really needed to empower them to make a call on what they wanted to do with their education. So historically, if you didn't want to go on placement, it was kind of bad luck. You have to go on placement, it's part of the job. But within this particular case, we allowed students to opt out. You don't have to go on placements right now. We understand that you might have concerns for your physical or mental well-being, or that of your family if you were living with someone who's a high-risk potential COVID patient. And we allowed them to completely opt out and say, I can't go, I don't think it's right for me to go. And we would make another placement for them as soon as it was appropriate and they felt comfortable doing so. Now, we can't guarantee when those placements are going to be, but we made it clear to the students that that was something that we could arrange for them at a later date, and we would get them through as soon as possible so as not to delay their graduation. But they were kind of taking a little bit of a risk, but we were going to get them through without them having to either delay for an entire year or go on intermission. We also really took charge of, or really wanted to make sure that our students had the resilience that if they were going out, they were able to handle it. So we have a touch base day, we call them back to base days. We have 4 of them, and with one of them, every student who was out on placement went through a resilience workshop with one of our premier resilience experts in Australia to work through how they would manage it and what they would do while they were out on placement. And that was received really well. But the other thing that we had to do was be really clear with our communication. But it wasn't just the clarity that was required, it was also the relevance. I'm sure everyone can probably respond to the fact that you're getting 1 million emails a day, particularly around COVID changes, COVID news. What we really wanted to do was just to make sure that the students were really clear on what is relevant to them. There was communication coming from our faculty, wider faculty. There was communication coming from our wider university. There was communication coming from the government. So we really wanted to distill it, making clear as what was expected of them and what was expected of our preceptors and sites. So we wanted our preceptors and sites to make sure they understood. So we've created these new EPAs, we've adjusted our program, but here's what is expected of you in supporting our students' mental health and well-being. The other thing that we wanted to do was make sure that we reinforce their contribution. We got repeated feedback from sites about how the students were allowing sites to cope with the surge that they were experiencing at their site, allowing them to actually continue service provision, and they couldn't do it without them. It was really just fantastic to hear how our students were actually grasping at that. So it allowed the students to be more confident and understand their role, and they really felt empowered to go out and do their role. We also had to provide some rapid responses. We were not letting things go. Anyone who was showing signs of potential issues, we were leaping on that straight away, removing them where required, and providing pastoral care if required. And I think the final thing that we really needed to do was understand that everyone had different personal circumstances. We had to be really empathetic here because, you know, we had a number of students whose family were either in Wuhan or in other areas around the world where they were directly impacted by COVID, where they had family members telling them that they were at a huge amount of risk going out in the pharmacy setting during a pandemic. And we had to really discuss with those particular student populations in terms of what it's like to be a health professional, how to handle that, and how to handle their family. So through these two kind of elements, making sure that the placements were as safe as possible, making sure they contributed in a meaningful way, promoting how that helped, and then making sure that our communication was clear and we had that pastoral care component specific to every student, we have had no student concerns with anxieties as of that final student agency survey in terms of allowing them to opt out. So it's been a really successful outcome as far as we're concerned this year. Thanks, Megan. That's about it from me.
Thank you, Simon. Those were excellent examples. You know, one nice thing about these webinars is that you realize that you're not alone, and that we're all struggling with the same thing, and our students are all feeling the same way. We have exactly the same student concerns that in Colorado here, and I definitely 100% agree with you about the communication. You know, there has been a lot of communication about this. Sometimes it seems like over communication, you know, and things are rapidly changing. I mean, you know, I will send out communication to students and going in one direction, and then the next day it'll be a different direction that we have to go in. So it seems like every decision that I make is the wrong one tomorrow, based on the changes that are happening. So I think that the communication is definitely key. And you know, I think this is also an example. This is an exercise in resilience for the students, as you mentioned, and that's very interesting that you had them do that resilience workshop. I think they have been able to be very resilient in this case, in this situation, and they've really taken the challenge and taken it to the next level. So thank you for sharing us your perspective on that and what you all are doing in Australia. Okay, so our next panelist, Caroline Weinstein Oppenheimer from Valparaiso in Chile, is unable to meet today. And so I can only speak very briefly about her bullet points, but one thing I will mention that Simon also mentioned is that you have to have empathy for your students. I know we all do. But they're in a very stressful situation, and so recognizing that and having empathy for them is important. So I will pass the baton to my colleague Kyle, and he's going to be discussing some things that they've done to address student anxiety in Otago at the University of Otago, New Zealand. So Kyle.
Thank you very much, Megan. Hello, everybody. I think I'm definitely, I guess it's early morning now. It's 1 a.m. in New Zealand, so it's nice to be chatting with you today. And I'm going to take a bit of a different approach than Simon, as he gave a really good overview of what happens when, you know, COVID happened and the steps that Monash took at that point. But New Zealand's been in a really good position where we've actually been able to come out of COVID quite rapidly. And we are now moving, as of today, into opening up more services and different aspects of the sector. So the area that I'm going to talk about is dealing with student anxiety as we move back into what is our new normal. And for that at Otago, we've really embraced the concept of the 4 C's. And the 4 C's I talk about are confidence, communication, collaboration, and care. And again, Simon really spoke a lot about these in his examples as well. But confidence, I think, is really important because students, they really look to the leaders and they look to their faculty members of whether or not, you know, if we feel confident or we are confident about how things are going to go, then really it just sets the whole tone for their upcoming placements or their upcoming rotations. And with all the uncertainty of COVID, and in New Zealand, some of our clinical placements got cancelled as we went into lockdown level 4. Coming out, we are fully confident that the students will be able to complete their placements, and as leaders and as experiential coordinators, we need to be able to exuberate this towards our students, and this has been quite helpful at the Otago model. In terms of communication, I think communication is really important. So all along, we've been very communicative with our students, explaining to them what's been happening, what the expectations are, where we're at in terms of negotiating with the sector, in terms of negotiating with the council, which in different areas of the world that might be your College of Pharmacists in Canada, for instance, or different areas of the United States, in terms of what's actually expected of students and where we're at in terms of having them actually go to their locations. In New Zealand, and probably somewhat similar to many other countries, students go to many different parts of the country for their rotations. So they're not just in Dunedin, for instance, or Auckland. They're in Wellington, they're in Christchurch, they're in Invercargill. And so we need to be having strong communication with them as they plan for things such as accommodation, such as transportation, as they move into, say, a 4-week placement in, even if it's a couple months from now, they need to be able to have those that information ready to them in order to make those circumstances possible for them. Collaboration is another very important point. So for this, as Simon talked to as well, it's really important to engage the sector. So as we're coming out of COVID right now, not that, again, second waves can happen, but New Zealand's been in quite a good position, and I really hope the rest of the world will end up in the same position as New Zealand at the moment. But collaborating with the sector in terms of what does it mean when a student can come? And when we call level 2 here, which is social distancing, but yet services are able to be open. But what happens when we go to level 1, which is less social distancing, but more crowd control? And what are the actual roles and responsibilities that students can have in these different levels? And so we've worked quite closely with the government, and I think this is a really important point as the government opens up different aspects of the sector. The programs need to be having those conversations with the government and with the sector in order to really establish where the students should be working and what the different roles and expectations that they should have within those different levels. And then finally, care, and this really results back to what Simon said about empathy. Our students are, they're kind of, it's been a very unknown, unprecedented time in pharmacy education, I would say, around the world. And so to have some empathy with our students, again, we've worked with Karen to bring in some resilience-based training into Otago as well, and to really understand where their anxiety lies, and to understand that if they were meant to be at a placement in Auckland, but they can't get to Auckland and they need to be in Dunedin, that we can account for that and that we have a plan in place in order to understand what their limitations are and that we're able to accommodate their needs and engage the sector as necessary in order to ensure that their clinical training does occur and that they meet the requirements prior to graduation. So I'll turn it back to you, Megan, but those are the 4 C's that we've utilized in New Zealand today. So.
Thank you, Kyle. That is, I love the 4 C's program. Again, can't stress enough how important the communication is, and to be honest in the communication to students and your external partners or your sites. But also thank you for pointing out the collaboration with working closely with the government here in Colorado. Our university does work closely with our state government as well, and our state government is acutely aware of the needs of our healthcare trainees, so it's very important collaboration. So thank you for pointing that out. All right, so we'll finally hear from Priscilla, our student, and get her perspective, which I'm very excited to hear. Priscilla, you have the floor.
All right, thank you so much, Megan. I just like to say that it's great hearing all the things and measures that are being put in place to help solve students' anxieties. Because as has been mentioned, communication is very important for us in this time, because it's very uncomfortable just being at home, not knowing what's going to happen to you. Because as I listed here, our main anxiety concerns from a few of my colleagues and for myself was what to expect in the final exam, since the pandemic has come in the way of clinical rotations, and specifically for the 6th years and the APPEs for the 5th years. And one other anxiety concern was how to fill in for the time and experience lost, which from what our faculty heads have stated in the initial slides has all been met. And what happens if another pandemic hits? So for this, I'd like to say that I think online experiences has come to stay, because just as we didn't expect this, we don't expect another pandemic in the next year and the following years that are ahead of us. So I think online experiences is something that has come to stay, because in the years to come, in the months to come, we have no idea what the fate of the student is. So I'd like to say that everything that has been stated here, trying to make sure that the student meets requirements, trying to make sure that you communicate effectively with the student, and as was stated, it's not just about the communication, it's about the relevance of the communication, because we're always getting news from here and this, and the numbers are increasing and that, and that's not what you want to hear. What you want to hear is, what is the fate of the students? What happens if another pandemic hits? How do I fill in for the time and experiences lost? I'd like to say that for here in my school in Ghana, we are being given case studies, real life case studies that have been fetched from our hospitals to work on, again, using the SOAP approach. I have spoken with a number of our final years, the 6th years, and they have been having discussions amongst themselves on cases, because apparently we just as was stated earlier, it's very important that you have collaboration with especially the Pharmacy Council and the government, because they are in charge of the license exam, which the pharmacy students get right at the end of the 6 years. So they're just waiting for the timetable to be set, because they're wondering if they're going to write it in the next 2 months, the next 3 months, due to the pandemic. So just as they wait, they're having discussions amongst themselves, and online case studies being submitted. And I'd like to also add that in our part of the world, sometimes the internet isn't too good. So for those who don't have good internet access at all, the case studies and other assignments have been posted to their district education offices. The students go and pick it up. They work on the cases and submit it there for it to be picked up. So it's good to know all the things that are being done for us. Thank you.
Thank you, Priscilla. I want you to know we hear you. We understand your concerns. One of the things that I think is also important, that we've taken an approach of shared decision making with the students, and having them offer solutions to us, because they can think of, sometimes they have ideas that we have not thought of before. So involving your students in that decision making has been very effective for us. So thank you for sharing that, Priscilla. All right, so moving on to question 3, what are our accreditors or regulators doing to help? Well, briefly, in the United States, our accreditation body has been very, they've offered a lot of flexibility. Unfortunately, you know, they have to uphold the requirements, and so there's not a whole lot of wiggle room, but they definitely have been working with us to be creative. And I'll briefly touch on what some of the flexibility is from our accreditation. So what the first thing is that they have allowed schools to create a test out option for students. So students who have extensive work experience in a pharmacy setting, if students or if schools can develop a way to test the student's competency in that specific practice setting, then the students will not have to complete their hours in that specific practice setting. They do have to complete the total hours. The hours is not something that can change, but you can use alternative ways for the students to make up those hours. So that's been very helpful. That is only allowed during this pandemic. This is not, that's a COVID only exception, and it's only for the introductory pharmacy practice experiences, the early experiences. Also, they're allowing telemedicine, if it's designed properly, can count as direct patient care, as I mentioned earlier, which is very useful for us, particularly in our ambulatory care and community pharmacy settings. They're also allowing volunteer COVID screening to count as hours, as experiential hours, as long as there are learning objectives and that have been developed, and the preceptor is a healthcare professional. The preceptor does not have to be a pharmacist in this case, but they do have to be a healthcare professional, which has been very helpful. But also our state boards of pharmacies, as Jamila alluded to much earlier, was that they are allowing, it's important to work with your state boards of pharmacies, and although there's not a whole lot of room to make exceptions with our state laws, they are allowing some suspensions or changes in some of the rules in terms of what our pharmacy interns can do, and what our preceptors can do and how they can precept. So that's been very helpful. Now Fawad is going to talk about what's happening in Lebanon. Fawad, what can you share with us?
Hello again. So as I've said earlier, the national regulators provided some support to help during this period, and particularly with the remote experiences. As the problem is not only about the restricted access to practice sites, but also there is another problem, is that there is restrictions to the admissions, to the patient admissions of non-critical cases. So even the ambulatory the care, the outpatient departments, they were shut down. So having on-site practices are not really possible during the lockdown period. So the regulators approved distance learning and remote activities that support, facilitate, and help to fulfill the requirements of this academic year. The aim is also to maintain on-time graduation and licensure. For this, the Lebanese Order of Pharmacists approved the virtual rotations that I've previously described as an alternative experience to fulfill the national practice requirements during the pandemic period only, and to account for eligibility to sit for the national examination and for the acquisition of the license. Thank you.
Thank you, Fawad. It's nice to know that there is collaboration and flexibility. They definitely understand our predicament, yes. So that's very helpful. So thank you for sharing that.
Thank you.
And finally, we'll hear from what they're doing in Australia. Simon, what are they doing in Australia?
So many things. No, there was, as I mentioned, we had a situation where we were kind of rolling with it before the accreditors really had a chance to get moving. But since then, they've been really they've really successfully addressed the major concerns from our perspective, and I think from the wider not only profession but also the other pharmacy schools in Australia. What we received fairly recently, or not fairly recently, but a few weeks ago, was the National Guiding Principles for Clinical Education, and that was for all health professional courses in Australia, of which obviously pharmacy is one of them. And that was a joint statement from our regulator, so our registration official, our accreditor, and also the Australian federal government, and that was from the Ministry of Health and the Ministry of Education as well. And the key thing from them was similar to what we had been doing, which was safety as the primary focus of the placements, obviously only taking part if they were COVID safe, but also they really supported the continuity of clinical education in Australia, even during the pandemic, provided that safety could be supported. The government is very aware of and the regulators are very aware of the requirement for the surge workforce, and they saw exactly how our students contribute across all of the health professional courses. In terms of how it impacted us, they really kind of outlined that there would be flexible approaches to course accreditation and performance standard, focusing more on outcomes rather than meeting a number. And the message that we really received loud and clear from them was, this is kind of a case by case thing, as no one has the exact same standard. So we were very lucky in regards to having these structures of guiding principles for our clinical education. But the other thing that they did was then looking forward into the internship, so the postgraduate experiential learning component, just reviewing the assessments to make sure that there's not going to be any workforce shortages in the short term. I think that we are really focused in Australia of making sure that there isn't any interruption to our pipeline of health professionals, and understanding that this could be a potential area for disruption. So really allowing that flexibility in terms of how you can implement these experiential requirements has been a godsend during those uncertain times. So that's something that we've been really lucky that there's been that leadership in Australia. Thanks very much, Megan.
Yes, thank you, Simon. It's nice. Yes, we're having similar conversations here in the U.S. about competency versus hours and those types of things. So it's nice to hear that we are talking about the same thing. So, all right. So on to our final question. What are things we can do now to prepare for the future? Because I do think that things are going to get a bit more difficult before they get easier. So what can we do to be proactive? So Vigu, let's hear from you again about some simulation ideas that you have.
Yeah, thank you, and welcome back. So some real big issues here with regards to what can we do to prepare for the future. Now, whenever I ask myself this question, it always seems like a really exciting, innovative process where you can be really creative with what you want to do going forward. But we're in a very different world now as we're going to be entering into this new world. There's some key things that we need to think about, certainly, and that is not all students will return to the university at the same time, irrespective of what the situation might be like in the UK. And this is from the University of Nottingham's perspective. And that's a big thing. We have students represented across 26 different countries. And as a result of that, we have to prepare for the fact that actually the way in which, and we've already seen the way in which different countries are dealing with COVID-19 has been very, very different, and certainly not perfect in the UK, far from it. But irrespective, we really have to factor it in that the fact that we may have some of our students still in the countries of which they originate from and coming onto the degree program or coming into a particular year group. I think the other thing I also think about with regards to moving forward in terms of the future, and that is, once again, I think at this stage now we need to think about brand attraction. That's obviously one big thing that a lot of universities, especially in the hierarchy of the universities, are thinking about in terms of recruitment and attraction and maintaining certain levels of status within your university, etc. So again, that's really important. And sometimes we've used some of the courses that we have, some of the USPs that we have with regards to our learning content as a brand attraction. So it's really important as we start to move towards thinking about online learning and replacing face-to-face learning and replacing experiential learning, that you also think about your brand attraction and your recruitment, because like I mentioned earlier on, a lot of students are thinking about doing pharmacy because they are wired in a way in which they want to do a very hands-on vocational activity in the future and a job in the future, and as a consequence they are going to very much expect a particular style of teaching. So with that in mind, the next thing I think about is the movement from face-to-face learning to online learning, and that transition itself has many difficulties, potential challenges, potential pitfalls, but also presents itself with a new opportunity, I suppose, is a different way of looking at it as well. So some of the things I'm thinking about at this moment in time is thinking about the framework, the learning framework that we have, thinking about the learning outcomes that we have, and making sure that I don't make this too complex. So as I move towards a different set of parameters and learning parameters, I establish that these learning outcomes essentially are there, and what they need to do is they need to translate differently to how they're being achieved. And I suppose that's very, very key. Now, at this moment in time, start to think about what might happen after the whole COVID situation ends or comes to some sort of resolution. What kind of world are we left with after that? And as a consequence, whatever systems we put in now need to be functional for that period of time. Otherwise, that's a hell of a lot of work that we guys are doing as academics in this just for this year. So as a consequence, I think it's important to have a very blended approach, both asynchronous and synchronous learning, because I think that's really important that students that are going into a pharmacy degree have some sort of scaffolded structure and framework for their learning. I mean, the success is related to the student support network. We've already heard from my learning colleagues in New Zealand and Australia. That student support network is going to be really, really important, and the success of whatever system we implement in the future is going to be measured by the ability for the students to connect with the academics efficiently and get that support mechanism, connect with the university, connect with the pastoral systems that exist. But what I feel really important, especially with myself dealing with final year students, is their ability to connect with each other, their ability to connect with the other schools that we have in terms of medical schools, the interprofessional activities that they potentially could do, and their ability to connect with the content is going to be really, really important. So I think they're the key things that certainly the University of Nottingham are thinking about. Those challenges are certainly going to be in place up until the new year, so 2021, where some of our students are not all going to be in the same location, so we really need to think about that. And the final thing we're thinking about really is obviously with regards to social distancing and thinking about how we deliver face-to-face training with respect to that, and that's going to be a key focus. I think finally, with respect to preparing our students for or graduates for the new ways of the world and how they should work within that world, I think it's really important how we develop that resilience and that skill set for our students. And maybe there's an opportunity for us to increase our focus on leadership skills practice, preparing those students with regards to their leadership skills, their mentoring and coaching skills, their ability to interact and understand the public better. There's opportunities to factor in teleconferencing and online support with regards to patients, and there's opportunities to bring that into your blended approach to new modules and the way in which you teach your students. I think including the challenges as part of the simulation, certainly something that we are going to do, including the challenges as part of the simulation. And as we navigate those challenges and overcome them potentially, we can introduce those same challenges into the simulation so that the students navigate those problems with us and at the same time. So as a consequence, they too are prepared for this new way of working in the new world. Thank you.
Thank you, Vibhu. I agree. This is the silver lining in all this is the opportunities that we might have in the future. And excuse me. But you're right. We do have to be very thoughtful about how we're going to make those to make any changes and really that are meaningful, that also meet accreditation standards. So thank you for sharing. Jamila, I'm going to pass it over to you, and you can talk a little bit about telehealth and the future of experiential learning in that realm.
Yes, thank you so much. And I've heard some of the previous panelists speak to telehealth and telecommunication and its usefulness in experiential. And I really do think that this is going to be the wave of the future, or something, or things that we can add to our experiential repertoire when we're helping the students develop their experiential year. I just want to go over some quick definitions, because telehealth, telemedicine, and telepharmacy, the terminology isn't quite interchangeable. Now, when we look at telehealth, it's the use of electronic information and telecommunication technology to support or promote long-distance clinical health care, patient and professional-related education, public health, and health administration. And this definition is from the APHA. Now we have the definition for telemedicine as the remote diagnosis, treatment of patient by means of telecommunication and technology. The telepharmacy, or the practice of telepharmacy, can be defined as the delivery of pharmaceutical care via telecommunications to patients in locations where they do not have direct contact with a pharmacist. Now, these services can include medication therapy management, or MTM, chronic disease management, transitions of care, pharmacogenomics, remote dispensing, and also ambulatory care service. Now, as mentioned, I think by Priscilla earlier, like, what happens if the COVID pandemic comes back? What happens if it doesn't go away? While a lot of the health talk has been around COVID-19, we still have patients who are diabetic, asthmatic, hypertension, etc. And our pharmacy students need to learn from these patients. They need to know how to assess, collect, implement therapeutic plans, and then evaluate those therapeutic plans. But with social distancing, they're not able to do it in a face-to-face setting. So really, out of the genie's out the box, a lot of patients and a lot of healthcare practitioners will probably start moving to a telehealth or telepharmacy setup. And we really need to make sure that our students are prepared to deliver healthcare in this new and ever-changing system. Now, some of the challenges could be when you're looking to set up a pharmacy situation, is quality assurance. Now, these sites may be far away from your actual pharmacy or your school, and we have restrictions of staying in place and sheltering in place, so you can't really go there to see what the actual setup is. You need to find out, do they have the collaboration agreements to get the necessary patients? Do they have the technology set up to allow students to view a patient's chart, but also keep patient information safe? Do they have the necessary setup to also give students the necessary assignments and activities on this experience so that they're actually learning and growing as pharmacists? Now, some of the solutions that we implemented at the Howard University College of Pharmacy is that we developed tools and tips to help really evaluate the site. We asked for preceptors to send, or any possible preceptors to send us their CV, a copy of the pharmacist license, and a description of the rotation experience, so we can make sure that they have an idea of how they're going to deliver pharmacy care and how they're going to integrate the pharmacy student in there. We also set up calls and or webinars to kind of go through their pharmacy setup and also view any technological platforms that they have at their site. Then we're also going to utilize the site and preceptor evaluation forms that all students complete after the completion of the experiential experience. This gives us a chance to really review and see, did the site actually live up to what they said they were going to do, and how did the students really feel and evaluate the experience? As what Megan mentioned earlier, accreditation bodies are good to help get an idea of what we can do and what we know moving forward in terms of telehealth and telemedicine. ACPE has allowed certain telehealth communication or telepharmacy experiences to count as direct patient care. However, with this pandemic possibly continuing growing, we're going to get more and more information from both the accrediting bodies and different state pharmacy laws and how these new systems will work and where pharmacy students can really fit into the system. So I'm excited to see pharmacy students really taking the lead in learning how to deliver pharmacy care in this new and ever-changing environment. Thank you.
Thank you, Jamila, and I'm sure that our panelists will be excited to see some of those tools and tips for quality assurance. This is, this is something that definitely is a concern of ours too when we talk about remote rotation. So, all right, as I mentioned before, our Caroline from Valparaiso is not able to join us, but really it's time to be innovative, both in the short term and the long term. It's okay to be creative and be prepared with novel strategies, and also, but in a very meaningful way, as Vibu pointed out. So Kyle, I'm sorry, we saved the best for last and the latest. I know it's probably, reaching the daylight hours now again where you are, but why don't you talk to us a little bit about sustainability?
Sure, and I'll keep it brief just because I know we're getting close to time, but yeah, it's 1:30 a.m., but the night's young, I guess that's what they say. I think that as we move out of the acute COVID phase, really what we need to think about is sustainability, and it's that aspect around workforce development and normalization. And so although we hope that there's not a pandemic next year, there's not a pandemic in 5 years, we don't know if that's going to happen or not. And so now that we have this experience with COVID-19, I think that it's really important that we build on that experience and come together as a profession to determine what it is that students can do in terms of clinical placements, and B, at what level that may occur. So every country is different, again, in terms of their restrictions. However, I think that coming towards maybe an international consensus document, for instance, led by FIP, might be a really good way to lead that. Also, in terms of fit for purpose assessment tools and tasks, so I've been working with a couple of different countries in terms of, we've talked a lot about virtual experiential rotations and experiential experiences today about assessment tools. So we need to really adapt how we're assessing our students, and that will really help with their buy-in and their confidence with our programs moving forward. So being assessed with our standard communication rubrics in a Zoom space or in a WebEx space or an online space is not quite the same, and it could actually be disadvantaging them. And so I hope that really COVID-19 sparks a whole line of scholarship in teaching and learning in terms of the types of assessments we're doing and the types of looking at the different tools that we're using in order to assess students, whether it's differences in clinical placements or in the online space, in order to really ensure that they're being validly assessed based on what they're actually trying to achieve. And so with those 2 points, I think that that's where we can focus on sustainability. And again, I wish everybody luck as we move forward through the COVID-19 space. Thanks, Megan.
You're welcome. Thank you, Kyle. We appreciate those comments. All right, just to wrap it up, thank you to the panelists. We heard a lot about virtual and remote experiences. Just a final word, remote education obviously cannot replace experiential training in its entirety. It can be used sparingly, and we can get creative, as you've seen here. It's an important alternative in these challenging times, or if you encounter other challenges, non-pandemic related, it could be a good alternative. It can help maintain on-time graduation, but students really do still need some access to or involvement with patients, and obviously accreditation regulator standards will still have to be met. We saw examples here, or we heard examples today about how curriculum may have to be altered to address existing and unknown challenges in the experiential environment, but we heard of some good redesigns. Student expectations also might have to shift depending on the situation, but as we mentioned, they have been very resilient and receptive so far, and they are our future. So it's important to include them in the decision making as well. So the future of experiential education is here, whether you like it or not. It's among us. It's no more status quo. It's time to get creative and think outside the box. Think outside the box, which many of you have described here. So in the interest of time, I will open it up for questions. We'll have Toyin manage our questions if we have any, and we'll be happy to answer. So Toyin, I'll pass it back over to you.
Well, thank you so much, Megan. Fantastic job with the team of panelists from around the world, and special shout out to our New Zealander who's with us, who really has been such a dedicated person, making sure that he stayed up all the way through 1:30 a.m. Oh my goodness, thank you so much, sir, for your participation today. And we want to welcome you all again, for those who joined at the time when the webinar was on. This is our FIP COVID-19 number 10. We're focusing on experiential education. You can tell that we have had quite a bit of questions and quite a bit of responses from our panelists, and we know you have specific questions of your own. So we'll be looking at the portal now and seeing what kinds of questions we have. I must let you know that there is a possibility that we won't be able to get through every single question, but we will do our best to make sure that we address as many as possible. If you haven't done so already, we're asking that you please make sure to indicate, you know, which country you're from, so we can give a shout out to your organization as well. Thank you again for joining us. I would like to start to acknowledge Bibu from Malaysia. And thank you for joining us. I see Jayaseka from Oman. And the question that Jayaseka has is, how do we manage students' experiential training in the pandemic periods? I believe a lot of people have said that already. Is there anything that somebody wants to add that hasn't been said?
This is Megan Thompson. I'm sure there are a lot of other examples that, obviously we didn't cover today, but our panelists have provided hopefully some ideas that you can take forward and use little bits and pieces that will accommodate your own program. But we've heard some pretty good examples today. I think we all share the same challenges, so we've been pretty creative. Thank you, Toya.
All right, and I encourage you to go back to the recording. This webinar, excuse me, is being recorded, so you'll be able to listen to that. Thank you to Jacqueline Aruajo from Salvador, Bahia, Brazil. Thank you so much for joining us. I also have Ron Eros here, who is curious from Canada, and is curious, did you have a maximum number of students in your cohorts? I think Ron is referencing you, Megan, from Colorado.
Yes. Yes, thank you for bringing that up. We did have a maximum number in our hospital cohort. We had a maximum number of 30. We were prepared to take 60, but we did not need more than 30, so we capped it at 30. In our ambulatory care community, we had no maximum. We were ready to take as many students as we needed to. We ended up having 78 in that cohort. So they were fairly large cohorts, but we were able to make it work with the model that we developed. If you'd like to learn more about that, you can certainly reach out to me and I can give you more specifics. Thank you for that question.
Fantastic. I have here Rita Akonogere is calling from Nigeria. Forgive me, everyone, if I don't pronounce your name accurately. Rita is concerned and worried, actually, that there might be a focus more on students graduating rather than the quality of training. And her fear is virtual experience may reduce quality of training. What are your thoughts?
Can I come in?
Well, I'll give you an example of our answer in Colorado. Yes, absolutely.
Priscilla, go ahead.
Okay, to Rita, I'd like to say that from the various panelists, you'd noticed or you'd realized that their key point was to make sure that the student not only is able to graduate on time, but meets the requirements. So they're trying to make sure that what you have gotten from on the field experience, you get it from the virtual experience. So I don't think it's basically just focusing on them graduating, but making sure that the experience they would have had from the field, they get it from the remote education too. Thank you.
All right. Nora Al-Qudair is calling in and asking you specifically, Fuad, and is thanking you for your presentation and has two questions for you. How many students do you have in the internship year, and how do you follow up the quality and delivery of these activities?
Okay, hello again. So in fact, for the B-Pharm program, we have like around 150 students in their final PPEs. We have groups of 5 students each per preceptor. In the PharmD program, which is an additional optional 1 year of APPEs, we have 31 students. Also, we have 5 students per group of preceptors. Well, we've heard multiple questions about the quality of the virtual PPEs and APPEs. So that's another challenge. Yes, this is a new experience. And for sure, we understand that students get greater experience with the standard rotations. However, we are working to provide the maximum quality of these rotations, particularly that the faculty preceptors are registered pharmacists, and they are closely supervising these rotations on weekly basis, spending several hours of mentoring and follow-up with the students. And we are also depending on our preceptors' creativity, as they are also playing the role of different healthcare providers to maximize the experience. We will be also evaluating this new experience to learn more from and to help to redesign future experiences if necessary. Thank you.
Great, thank you so much. Fuad, it turns out Rita was curious as well about what kinds of network challenges, well, if you had network challenges, how did you assess the students effectively? So that was directed to you particularly as well.
I didn't get the question. It was about the what kind of challenges?
No, considering network challenges, how do you assess the students effectively?
There's a live discussion with the preceptor. There's an online discussion. It takes place. It's live. It's a video call, and there's a live meeting. There's a group of students with their preceptor in the meeting, and the discussion takes place. The preceptors still have the questions and the answers they are looking for. The preceptor is using a kind of assessment rubric to look for a certain information that the patient had from this experience, as the evaluation of the pharmacotherapy, the interventions, the SOAPs, so the possibility of having different plans for this patient. So the preceptor will use different assessment rubrics in order to have this assessment, and all of these, they are taking place by live meetings online with a video call. So the preceptor and the student, they are seeing each other and they are going through this discussion and assessment. I hope that I clearly answered that kind of question.
Thank you so much. There's a question for Simon by Ken Manson from University of Waterloo in Canada. Thank you, Ken. How many students opted out entirely and how many opted for the new rotation you were creating?
That's a really good question, Ken. We actually had a bet running within my department as to how many it would be in total after we provided all the information to the students. In the end, it was only 3% of the cohort. So there were only, I think it was 9 in total who opted out, but a lot, and that was across 2-year levels. So we actually found that the vast majority were comfortable once they knew exactly what the rotations would be, and once we allayed the concerns that they had given to us. And we did that through FAQ webinars with Q&A functions, and also providing up-to-date information regularly. So really few numbers, but that was after we had done all that really detailed communication.
Thank you. There's a question here from Vinita Aurora. I'm not sure where Vinita is from, but thank you for joining us. The question here is, were there unanticipated financial implications for students, you know, with regards to move-in, residential arrangements, tuition refunds, and such, that resulted in student anxiety to warrant any significant initiatives from programs?
Maybe I can answer here. In terms of student financial issues, I think it was something that we were definitely conscious of in New Zealand, because when COVID hit, all of our students went back to their, I would say 50% of our students went back to their hometown, and 50% stayed in the university city. And so once our restrictions were lifted and we were able to actually reinstate our clinical placements, students were then needed to travel back to their hub sites where they were actually going to be completing their placements. So there was some financial burden, but it wasn't any more than what we had expected from our students in order to actually get to their hub sites in the beginning. But I do think that this question might be quite country specific in terms of what domestic travel is occurring and how students are actually able to move around the country and to their sites that they're allocated to as a result. New Zealand's quite a small country, so I'd be interested to hear what a larger country might have its perspective.
Thank you. We have quite a bit of questions here, and I know we're well out of time, so I'm going to try to bring some of those to the forefront. Dr. Laila J. Badran is calling from Jordan. Welcome. Thank you for being with us. And the point that that person is making is online learning for pharmacists cannot be applied for certain topics that need actual practical laboratories. What are your comments as professors? You are accurate, and Megan already stated that, I believe, at the end, and we invite you to join another COVID-19 related webinar on assessment specifically. If I recall correctly, in that webinar, there will be reference to how to handle lab related matters. That will be holding May 28th, so stay tuned for that. I believe you will have more information on that, but if somebody would like to speak more to that today, that's fine too.
Megan, this is Sean, or Toyin, this is Sean. Thank you so much for bringing up that question. Looks like we've got that as a pretty common question about running laboratories in these times, and that will be addressed on the online number 2 webinar, which, as Toyin mentioned, will be May 28th. But some ideas that we're discussing to present there are, you can do laboratory experiments. There are a number of virtual simulated lab experiments that are available. Even I just saw one last night from Purdue University doing an IV room. Recognizing, of course, that if there is limited internet, that may not work. So things we've discussed are, you could perhaps even bring students back to campus, recognizing the social distancing restrictions, limiting access to campus. There are things that are essentially sending a lab in a box that Claire from Nottingham has shared with us for use in Kenya, where materials are sent to students. And again, coming back to campus and doing simulated activities or live activities in a social distancing manner. But again, we're going to be addressing this in more detail on May 28th.
Thank you so much. I believe Tina Brock from Monash is asking, is there anything this pandemic allowed you to do that you had wanted to do anyway?
Tina, this is Megan Thompson. We've been wanting to sort of break open the box and try something different for a number of years. We've just been very sort of limited by our curriculum and the outcomes of our own curriculum. But we've sort of blown that up, and that's been very exciting for the faculty as well. They've been allowed to be very creative. And so this has really been a great opportunity for us to try a lot of different things, virtual rotations being one of them, telehealth, expanding telehealth opportunities is another, etc. But thank you for that question.
Yeah,
yes, this is Jamila from.
Go ahead, Jamila.
I just really quickly, I wanted to say that we are actually at Howard University moving practice forward and doing a lot of practice transformation. We have some of our pharmacists going out and doing COVID-19 testing and really being leaders in the Washington, D.C. metro area in terms of COVID-19 testing and helping to find a cure, helping to work with patients. So that's really what we're excited at Howard University.
Thank you so much. Mohammed Real from Lebanon is stating, thank you for joining us, sir. Remote, online, and virtual education will remain in the educational system even after the pandemic. We agree with you. The challenge now is to prepare students, faculty, and preceptors to be technologically skilled and competent. We agree. Nida Wadi is calling from Oman and is asking how we can run virtual during COVID-19. Nida, we encourage you to utilize some of the ideas that were shared already today. This webinar will be available at www.fip.org. And we're happy to answer some of your questions. Some email addresses have been posted. And then we have a few shout outs from Felicia from University of Ilorin. Thank you for joining us. We have Nohad Alamari from, I believe, Iraq. Thank you for joining us. She's curious about a common conclusion we can follow. There's so many things you can do, Nohad, depending on your situation. I think Megan mentioned that. Nuvi is calling from Indonesia. Thank you for being present with us. We thank you, Jitali, for joining us in spite of the challenges you had. We're glad you're with us. Gilly is joining us from South Africa. Thank you. Grace, thank you for joining from the Philippines. And she's stating most of the experiential learning that was presented would mostly require the use of the internet. Do you have any recommendation for countries that do not have very strong internet connections? I think that's a good one to address. Priscilla, do you want to take that one?
Yeah, thank you. Okay, so as I mentioned earlier, for Ghana, some students are in very remote areas and in villages, and they don't have access to good internet. So our school has provided for them, for now, case studies, since currently the hospitals don't want the students to be around because they want to do away with congestion, as it would promote the spread of the virus. So they have case studies that are being sent to the district education officers, and the students are able to come to the district officers and pick them up, because the school has everybody's either phone number. We have been given phone numbers, phone numbers for a particular network, which all students have. So they communicate with them on that. If they don't have internet, it goes as a text message. They receive the information that, oh, the case studies have been posted, and they go for them. The case studies are case studies that are for cases in the hospitals, chronic diseases, and a whole lot of things that are normal to the Ghanaian hospital setting. So it means you're not missing out on too much. Yeah.
Thank you so much. We're going to wrap up. We've really extended the time here.
Dr. Tufadi, if I can add one point, please. This is Fahad from Lebanon.
Yes, sir.
About the internet problem and the accessibility to the internet, there's a kind of solution, is that to have recordings, voice over PowerPoint presentation, that can be shared on a cloud or in a drive with the students, so they can download it at their convenience. And then this can be followed by live sessions when the schedule of the internet allows, in order to have a better overviews of the topics and the discussions. So this may help in different kinds of distance, as a general help in different kinds of distance learning. Thank you.
Thank you so much. I'm glad you added that contribution. There is another question here. There are several questions on lab. Like Sean mentioned, we invite you to join us May 28th to hear more about practical ways to implement lab or skills-based learning, so that you don't miss that detail. There is Ezekiel Akikumi, I believe, from Nigeria, is asking, can a faculty of pharmacy, college or school, who is part of a university system, do virtual education outside of the large university system that is not doing it?
So this is Megan Thompson. I'm not sure if this is if I'm gonna answer your question correctly, but we do have non-faculty preceptors external to the school who are in different states who offer remote rotations, virtual rotations for our students. We do allow that, but we do ask for them for a site description or a rotation description and their credentials, and we vet it before we accept that. I hope that answers your question.
So the key thing is to make sure you have permission to provide education in that format, and you have the blessing of your superiors. I think that's another piece to keep in mind. There's a question here also from the UK. How do we engage sites at this time when pharmacy education is difficult to sell as a priority in normal times with no financial motivation? That's Janique from the UK.
This is Vibu from the UK. So this, I think it just goes back to what my colleagues were saying about the 4 C's. For me, it's about communication, working with your stakeholders, Certainly in Nottingham, we've got some of our integrated degree programs where students are on their internships, and the key thing was just working with the provider, the placement providers, creating a platform for support and help, and generally just trying to make sure that their needs are met as well as our student needs are met as well as our educational output. So I think the key thing is relationship building and communication, and hopefully you'll yield the results that you deserve.
I think that's an excellent webinar topic for the future. That could be a topic on its own.
I tell you. On that note, we do need to wrap this up. There's a final question I think is important: is do you provide personal protective equipment for students from the university? That's coming from Gil. Gil is from South Africa, Tshwane University of Technology.
This is Megan Thompson from Colorado. We are in active discussions about providing PPE for our students, for all of our health sciences students, including medicine, nursing, dentistry, pharmacy. So we are in active discussions with our university to place an order for all of our students to have that.
Great. And thank you, Nora, for letting us know you're from King Saud University, Saudi Arabia. Thank you for calling us from all around the world, the Philippines, Indonesia, Malaysia, UK, Australia, the Americas, and South America. In closing, there's so much that has been learned. Megan, did you want to finish up with this slide to summarize it?
We've really heard a lot of good examples of creative ways to address experiential education, and the insight from our panelists was really helpful, especially for me as an experiential director. I've taken a lot of good tips from my own panelists, which is helpful. And we also learned that this may be an opportunity for us to improve our experiential education in the future and try new things. And we know that our students are adapting, and they are more resilient than they get credit for. And really, we rely on them to carry our profession forward. So we need to work with them together to make that happen.
Excellent. This is the time to say thank you. And I want to thank you, Megan, for leading these distinguished group of panelists from around the world in our planning committee, the FIP-AIM, led by fearless leader Wayne Hindmarsh and Pierre Moreau, FIP Academic Pharmacy Section, WDH led by Ian Bass, Academic Sections led by John Pieper, and IPSF leads as well. And our attendees, without you, we would not have a webinar. And thank you so much for all of you who stuck with us for this pretty much almost 2-hour session. This is really awesome. We thank you so much for your engagement with us during the entire period of time. And we want you to be aware that there is a survey that was sent out to several of you to complete. It should be in your inbox. We invite you to contribute to our global survey. And there's more to come about this. It's really a rapid response to collate institutional university level information on higher education sector responsiveness during COVID-19. It's been a pleasure to moderate the session today. Again, my name is Toyin Tafari. I'm Dean at the Howard University College of Pharmacy. We are so glad that you could join us, and we're such great delight in us just to serve you all. Thank you, everybody, and have a wonderful rest of your day.